We are back on Morning Line. Our guest is Michele Johnson, Tennessee Justice Senator, talking about what looks to probably be some type of Medicaid reform here in Tennessee with regard to block grants, something that the governor is partnering with the Trump administration on as it moves forward. Let's go next to Cindy. Cindy, good morning. Hi, Cindy.
Oh, morning.
Hey, Cindy.
I totally understand what's going on, but the thing of it is that if you didn't, to get on Medicaid, you had to have worked in the United States and paid taxes as far as that I knew. That because when I applied, when I broke my pelvic in 2 places, I had to apply for all because they said I paid into Social Security for over 40 years. Okay, so I didn't mind that. So I did. And I got it, but I immediately, since I'd been waiting on the list for so long, I kept calling. That's why I say Social Security was great. They will talk to you and help you and guide you to understand every question. Mm-hmm. And the main thing, you have to have your medical reports, which I have a lot of health conditions.
Sure.
So I do understand. The block because, see, when I go see my doctor, I didn't mind paying the $90 to see my doctor because it was cheaper than the insurance. But then I caught on to it where they continuously wanted to take blood tests, unnecessary tests, even in the hospital. I'm like, good God, you took my blood an hour ago.
Now that goes to it just with the big question of Medicaid and how it's used and the spending and all of this. That's what I wonder about. If part of the problem, aside from this block grant thing we're talking about, is that, the doctor's in hospital still when, some senior comes in with a headache or something, they run a battery of tests and it costs a fortune.
Well, so she's talking about Medicare, and Medicare is a fee-for-service program, which means the incentives are the more you have, every Band-Aid, every bedpan, everything costs per thing. Mm-hmm. And Medicaid is, in our state, Tennessee, since 1984 has been managed care. So the incentives are the opposite. The opposite incentives. They have a certain amount of money. The incentives are to deny care. Okay. Which is not to say that there aren't things that need to be looked at and focused on. Is there waste? Is there abuse? I mean, the question is always an issue when you have a program this big. And, the state has said they're on it. They're focused on squeezing all the waste out. And they should be, because it's our dollars. Mm-hmm. But what we've seen again and again is the amount of waste in a program like Tennessee is not. It's not that like poor people are taking advantage trying to steal, a surgery or a wheelchair. It is that. Is that sometimes providers take advantage, and that's why you have managed care organizations who should be looking at that and should be comparing doctors to other doctors and just looking at whether or not the taxpayers' dollars are being spent properly.
Let's go next to Wanda. Hi, Wanda. Good morning, Wanda.
Hey, good morning.
Good morning. What's on your mind?
I was calling about the kid care, about pregnant women get kid care. Mm-hmm. Well, why don't they put these men out and let them go to work and pay for their own insurance like they used to have to do?
Well, in fact, they do, actually. Most of the pregnant women that we represent work sometimes multiple jobs. Many jobs don't provide health coverage with their for their employees. Waitresses, home health workers. Many, even actually big corporations have stopped providing health coverage to their employees. But the folks that call us, they do work. They just can't afford private coverage because their employers aren't offering it. And I think that's a big misconception. We think, well, we have so many people, we have our unemployment numbers are looking really good. Mm-hmm. But the fact is, these are low-wage jobs that don't offer benefits. And so we have Tennesseans that aren't working their way out to the American dream without some of these programs that help them have an opportunity, at the American dream. So that's why I think the block grant is an interesting name, because I think it blocks prosperity, it blocks opportunity, it blocks ends of suffering for seniors.
When we talk about the rules with regard to businesses, businesses, I guess, are not required to provide health insurance, are they?
That's right.
It used to be, though. Now, was there a time if you worked more than 40 hours a week, that was the magic number that you had to be able to access certain benefits that the business provided, or is that how it worked? That a business, if they did provide insurance, you had to work at least 40 hours a week for them?
Well, I mean, the Affordable Care Act said that certain businesses, if you had a certain number of employees,
Right.
had to provide coverage, or if you had, but they didn't say how much you have to charge your employees. So if they provide coverage, they might charge them huge amounts of money to buy into the system. And also, if you have a smaller business, you don't have to provide coverage. And so, so that's the issue.
Fewer and fewer, businesses do. It's an expensive thing to do, and if they do, the coverage is not great. You're going to have high deductibles and all that. Now, that's still better than nothing, of course. But yeah, it's just amazing. There was a time, a couple decades ago, where it was pretty much standard. Now there's so many. There are people still today that are working in jobs that I know they can't stand, but they took it, not even because the salary, the money was lousy. It's because of the health insurance they get with it. Not that it's always great. Let's go next to Sandra. Hi, Sandra. Good morning, Sandra.
Good morning.
Hey, what's on your mind?
I have a family member who's a senior citizen. He is on Medicaid. He also receives SSI. At the time I applied for SSI on his behalf, I didn't know he automatically qualified for Medicaid. I'd like to keep him on Medicaid, but at this point or time in his life, I don't feel he needs Medicaid, but I feel because he's a senior citizen, somewhere down the road he's going to need it. How would the block grant affect that situation?
Yeah, so I mean, basically what the block grant does is it ends the partnership with the federal government. The federal government pays about 2/3 of every, 66 cents of every dollar that's spent on healthcare in our state is paid for by the federal government. And if we have to spend more money, the federal government is right there beside us, spending, matching. So this is going to be an end to that partnership. And the motivation from the federal government perspective is to limit their costs for the state of Tennessee. So what it means is we're going to have, maybe not in year one, maybe not in year two, but in very short order, we're going to have less money to spend on health care. And when you think about who are the people who rely on health care, the person that you're talking about qualifies for SSI. These people are not folks who have lobbyists in the legislature. We have children, we have seniors, we have people who have very little power to stop these sort of cuts. And we know that if you have less money on a program that relies on vulnerable people, we know who's going to be harmed by that.
All right, and I guess when we talk about the block grant, so when you take away that 2/3 amount that they match with us, okay, let's say that goes away, and then the block grant, is the block grant then, I don't know what number they'll decide how many millions of dollars they give, but you don't believe it will be matched up with that 2/3. And I guess the 2/3 just goes as it's spent in the state, so you never really know how much it is year to year necessarily, right? Yeah. And there's no cap on that, correct?
There's no cap.
So with the block grant, all of a sudden there's going to be a cap. Well, we're giving you for this next year $100 million, whatever.
Right. So the incentive is to stay below that cap.
So they'll know what it is. And they'll know what it is.
Yeah, they'll know what it is. And I guess the fact is, I think you can't understand this. It makes your head explode because you can't understand it unless you understand the politics of it, which is block grant has been something that the Trump administration has thought would win for them. They want a notch in their belt to say they got a state to do this. The Lee administration, unlike any other governor, has said, we want to help you get this notch in your belt. We think we can get more money from the Trump administration. The Trump administration says we think we can get more money from the state of Tennessee. So while the elephants do battle, the grass gets trampled. And the grass in this case are seniors and children in our state whose future really depends on our elected officials parking politics and solving the healthcare issues that we care about, which is, we have pre-existing condition protections right now. Our Attorney General has entered a case in Texas to take that away from Tennesseans. Privately insured Tennesseans are at risk of losing that pre-existing condition protection because of our Attorney General. We have 220,000 children who lost health coverage because our Medicaid program basically cut them off and hasn't figured out a way to put them back on again. I think that the thought is that Medicaid and health care is an issue for the left. But the fact is, Tennesseans, and we talk to folks all over the state, helping them struggle through this red tape every day. And the fact is, most people who call us are Republicans who are just trying to get through the red tape. And they don't really care. It's not a political issue for them. It's like, just help me get my kids and my parents the care they need. And they count on their elected officials to do the same.
Yeah, well, I mean, Tennessee is clearly a Republican state, and it was pro-Trump and remains so, okay? But yet, that doesn't mean if you vote for any specific candidate, you agree with every single thing that they do, whether you're Democrat or Republican. But, I mean, do you think that's one reason? I mean, Tennessee is heavily Republican. It has a Republican governor, of course, and it went for Donald Trump. Is that why you think that's going? And you think there are some who voted for him that, while they probably still support him, don't like this idea? Absolutely.
No question. That polls show that 70% of Americans are against block grants. I mean, mostly people don't even know what it is. And that's one thing I just asked.
Well, that's what I was going to say. I think people don't understand it.
They don't understand it. And the fact is, if this is something that we're going to put $8 billion at risk for, why do we not understand what's the upside? Like, there's no upside. So if it's that much money in the state budget we're putting at risk, we should have a real clear sense of how it's going to solve the issues that I'm thinking about my kitchen table.
But again, the upside politically then, be it for Lee or the president, is that they're going to be able to save money. It may be that kids aren't getting the help, but they can ultimately say, look, the bottom line, we've saved money, we have this surplus or whatever it is because of some of the policies, which means maybe ultimately less taxes, we have more money to go around.
Well, the problem I think with healthcare is that if you're either going to pay me now or pay me later. So even if you lower the cost in the Medicaid budget, it's going to be more expensive in other areas of the state budget. Because if you have kids going without healthcare, they're going to get sicker. So the woman who said, take away health care for pregnant women. Well, what happens then is if those pregnant women, don't have prenatal care, it's very expensive if they show up in the hospital with the baby that has been very sick. So hospitals and we, as privately insured people, are going to pay for this care in a less efficient way. That's the original idea of TennCare and the Affordable Care Act was, let's bring everybody in and then let's manage the care in a way that's more sane. Let's not like leave people out and assume that they're not going to get sick, because they will.
Yeah. It's
just we'll pay for it in an inefficient way.
Let's take a call from James. James, good morning. Hi, James.
Yes.
Hey.
Hey, this is the reason I'm calling. Mm-hmm. Now, I'm on Medicare. And these people are sending me back braces and stuff, and I saw the bills that they was charging Medicare, $700 for a back brace and stuff. Mm-hmm. Somebody in Medicare is not doing their job, Steve Rowe.
Mm-hmm. And I guess you touched on that, and that may be true. Again, the difference between Medicare and Medicaid, which was very interesting, the way you put it out there, and which I guess most people may or may not understand is just the incentive one way or the other in Medicare maybe to send him an $800 back brace he doesn't need and bill someone, whereas Medicaid, they can't really do that because they have a real finite amount of resources.
Yeah, I mean, you definitely should call, if there's any fraud like that, you should definitely call the Inspector General. The federal government has a hotline for Medicare fraud, and they should know about that, because that's a wasted, that's taxpayer dollars that are wasted, and we can't have that. That means it's money coming out of folks who really need the care. Medicaid is different in that you have a limited amount of money, and so the incentives are to deny care that's needed. And we see that at our office. We had about 1,200 individual cases last year. We see kids being denied really basic services.
How did cases come to you, by the way, again?
People call us from all over the state who are denied care or who lost their health coverage.
Okay.
And we help them through that red tape. But basically, we have kids being denied services that their lives depend upon because their HMO has an incentive to limit the cost.
That would be, for instance, a condition, maybe it could be a child with diabetes or something like that?
Yes,
a heart condition?
Yeah, they lose home health care. A child who is terminally ill losing home health care. We have one mom who is trying to enable her 13-year-old to die at home, and they just keep denying home health care and denying home health care. We go through an administrative hearing process where the other side is represented by lawyers. The mom wins, and she goes back to her mailbox 3 months later, and she starts all over again. So their incentives are to deny care, in some ways, some care needs to be denied, but with Medicare, it's a whole different thing. And you know, I don't know. I mean, the problem is none of these things are simple. They're complicated. There's always, with that big of a system, there's always going to be things that need to be fixed. This isn't it. This has no chance of fixing any of the issues that we all are facing and frustrated by in terms of the healthcare system.
Take a break. When we come back, our final segment with our guest. A few more phone calls as well. The lines are open, 737-7587. Block grants, Medicaid dollars. What are we going to do? We'll be right back after this.